Patients with chronic conditions such as asthma, diabetes, or heart disease are facing a serious mistake that few realize: not following their treatment plan correctly. This is not just carelessness or irresponsibility, but a sad reality that many people are suffering from. They stop taking their medication at the right time, sometimes because they forget or don't feel the symptoms bothering them, or sometimes because they don't fully understand the importance of sticking to a strict treatment regimen. These patients, for various reasons, may inadvertently take too little or too much medication compared to what the doctor has prescribed, leading to unforeseen consequences. The failure to adhere to medication use not only affects the individual's health but also places a significant burden on the healthcare system. This results in emergency treatments, costly hospitalizations, and, at times, leads to death. A heartbreaking reality is that every year, hundreds of thousands of patients die because they fail to follow their treatment plan. These statistics are unchangeable overnight, and it feels like we accept it as a given, yet we don't realize that it is a tragedy that could have been avoided. The pain of the patients, their families, and the doctors cannot be fully expressed in words. Every day, doctors see patients not following their instructions and witness the consequences of impatience and neglect toward their own health. It breaks their hearts to see these patients not understanding that just one pill at the right dosage, a little bit of patience, could help protect their lives, prevent them from falling into an emergency situation, and save them before it's too late. And the statistics, even though they come as warnings from global health organizations, are not strong enough to change the habits of many patients. All that remains is the sadness of witnessing the increasing failure to adhere to treatment, causing countless lives to pay the price. One of the main reasons patients fail to adhere to their treatment plan is stopping their medication or unintentionally taking the wrong dosage. These actions may seem harmless, but they can lead to serious, irreversible consequences. Sometimes patients feel that their health is no longer as severe as it was before, so they decide to stop taking their medication without the consent or guidance of their doctor. They might think they've recovered, that their body is strong enough to do without the medication, but the reality is different. They don't understand that stopping the medication suddenly can cause the condition to relapse, worsen, and even put them in a life-threatening situation. Additionally, there are many cases where patients unknowingly take the wrong dosage, either too little or too much, compared to the doctor's instructions. This often happens due to a lack of understanding or because of a busy life that causes them to forget to carefully monitor their medication intake. Some patients get tired of taking medicine every day and choose to reduce the dosage or skip a dose without considering the long-term consequences. These actions, whether due to ignorance or fatigue, can lead to a significant deterioration in their health. The sadness comes not only from the patients themselves but also from the doctors who dedicate themselves to helping them. Every day, doctors witness patients failing to follow instructions and face emergency situations that could have been avoided. They feel helpless when they can't convince the patients to understand that just a little impatience or carelessness with taking medication can come at a very high price. Patients being hospitalized in critical condition or, even worse, losing their lives. It's a pain that's impossible to forget, seeing patients not realizing that their health depends on every pill, every dose that the doctor has prescribed. The consequences of not adhering to a treatment plan can be extremely serious, sometimes irreversible. Patients who skip a dose or take the wrong dosage, even just once, can face unexpected emergencies. No one thinks that a small mistake in taking medication could push them to the brink of death. But the reality is, this can happen very easily. Doctors warn that failing to follow their instructions properly can cause a worsening of the condition, leading to serious complications or the need for emergency hospitalization. The sadness and helplessness arise when witnessing patients who, due to not taking their medication correctly, end up going through painful, costly emergency treatments. These situations not only cause suffering for the patients but also place a significant burden on the healthcare system, with treatment costs that cannot be offset by normal medical efforts. What's even more tragic is that many of these cases could have been prevented if the patients had been just a bit more diligent in following their medication regimen. Every year, thousands of patients lose their lives simply because they didn't follow their treatment plan. The statistics about deaths caused by the consequences of not adhering to medication are heartbreaking and cannot be ignored. In many countries, This has become a pressing issue, as people with chronic or long-term illnesses don't fully understand the importance of maintaining a regular and accurate treatment regimen. This not only affects their personal health but also robs them of their chance to live. The sense of despair is even more intense when doctors can do nothing but watch as patients face severe complications, when all efforts have come too late. Every day they confront the pain they cannot soothe, seeing patients lose the chance to live due to a wrong decision about taking medication. When patients do not adhere to their treatment plans, they not only face serious health complications but also cause tragic and costly consequences. Doctors warn that if adherence rates were improved, thousands of lives could be saved, and the burden on the healthcare system could be reduced. However, the reality is heartbreaking. Every year, hundreds of thousands of patients are admitted to the hospital in critical conditions simply because of a small mistake in taking their medication. What is even more sorrowful is that, despite numerous studies and warnings from health organizations, patients still don't fully understand the importance of adhering to treatment. Statistics cannot change their habits. Doctors and healthcare professionals feel deep sadness when witnessing emergency cases that could have been prevented if patients only understood the significance of every dose and taking their medication on time. The sadness grows heavier when seeing the ignorance and carelessness of patients leading to irreversible consequences. They fail to realize that skipping a dose or reducing the dosage on their own can cause the disease to relapse, or even put them in a life-threatening situation. People with heart disease, diabetes, or asthma, conditions that can be controlled if treated properly, don't understand that these small mistakes are slowly killing them each day. The sense of helplessness and despair rises when doctors can only watch their patients deteriorate without being able to change the outcome. Every day, they face unfortunate cases where lives that could have been saved are lost simply due to non-compliance with treatment. This is a great pain not only for the patients but also for the doctors, who have been unable to help them avoid serious consequences caused by their own ignorance and negligence. When patients do not adhere to their treatment plans, they not only face serious health complications but also suffer heartbreaking consequences that they themselves could have prevented. For doctors, the sorrow is even heavier when they clearly see that with just a little effort and adherence, the patient's condition could improve, and lives could be saved from critical situations. But instead of trying to improve their health, many patients continue to ignore instructions, accepting danger without realizing it. It's truly heartbreaking when patients with chronic illnesses don't understand that adhering to a treatment plan is the most important thing for maintaining their health. Conditions like diabetes, asthma, and heart disease can be well managed if the patient follows the doctor's instructions. However, a lack of patience, awareness, or even vague personal reasons causes them to skip necessary doses. Every time they skip a dose, they are opening the door to unpredictable risks. What makes doctors feel even more sorrowful and helpless is their inability to change the mindset of the patients, unable to make them understand that they are hurting their own health. These patients don't realize that they could be living healthier if they just adhered more seriously. And when their condition worsens, when emergency situations arise, they realize their mistake. But by then, it's too late. The tears of the doctors and the patient's family cannot soothe the sorrow of the loss that could have been avoided. Somehow, doctors always hope that patients will change, that they will understand the importance of following their treatment. But sometimes, that hope feels too distant when every day brings heartbreaking cases due to non-adherence to treatment. When patients do not adhere to their treatment plans, they not only harm their own health but also cause doctors and those around them to bear the pain and disappointment. For doctors, witnessing tragic emergency cases, where patients face severe complications or even death due to non-compliance with treatment, is an indescribable sorrow. Each of these cases is a dark reminder of the importance of following treatment plans, but it's something many patients still overlook. The sadness deepens when these patients don't realize that neglecting to take their medication or failing to follow instructions can put them in danger. Chronic illnesses like diabetes, heart disease, or asthma can be well managed if patients follow their doctor's guidance. But instead, many don't understand that a small decision like skipping a dose can increase the risk of a relapse and send them into an emergency situation. The feeling of helplessness and heartbreak intensifies when doctors watch their patients grow weaker with no way to help. They know that if the patient simply followed the treatment plan, their condition would improve, and they wouldn't have to endure painful emergency episodes. But the patient's impatience, neglect, and lack of understanding make every effort by the doctors feel futile. This causes doctors not only to feel disappointed but also deeply saddened, seeing patients who could be healthy instead suffering consequences that could have been avoided. Each emergency case is a painful reminder that adherence to treatment isn't something that can be ignored. But while doctors and patients' families worry, the issue of non-compliance continues to be a big and difficult problem to solve. Tears can't soothe the pain caused by the irresponsibility. Non-compliance with treatment not only causes physical pain for patients but also brings deep sorrow to those around them. Especially for patients with chronic diseases, failing to follow the treatment plan has put them in dangerous, unpredictable situations. Simple things like taking medication on time or attending regular checkups become insurmountable challenges for them, and as a result, their health weakens progressively, sometimes even leading to death. The sadness grows even deeper when it's clear that if the patient had simply followed the doctor's advice, if they had just taken their medication on time and monitored their health, things could have been different. Patients with conditions like diabetes or asthma can live healthily, avoid emergency situations, and maintain their well-being if they follow the guidelines. But because of neglect or a lack of understanding, they risk their own health. Every time they skip a dose, they are pushing themselves into a dangerous situation. For doctors, this is a pain that can't be expressed in words. They feel helpless watching their patients gradually weaken, knowing that with just a little compliance, they could live a healthy life, free from the suffering of emergency episodes. But the patient's mistakes make the doctors witness deaths that could have been avoided, people passing away in unnecessary pain. The sadness and disappointment weigh heavily on doctors as they can do nothing more than care for their patients in their final moments, when everything has already gone too far. The efforts to save them cannot erase the sorrow caused by the patient's lack of responsibility for their own health. These feelings are not only a burden for doctors but also an unforgettable pain for the families and loved ones of the patients. When patients do not follow their treatment plans, they not only put themselves in danger but also leave a deep sorrow in the hearts of those who care for them, especially doctors. The feeling of helplessness and pain is something doctors must endure each time they witness a patient with a chronic illness who cannot improve their health simply because of impatience and non-compliance with treatment guidelines. Every day that passes, the patient continues to skip medications, miss checkup appointments, while their condition worsens. For doctors, healing is not just a job. It is a great responsibility toward each patient. Every time they prescribe medication or offer treatment guidance, they hope the patient will follow through to improve their health. But the reality is different. Many patients do not realize the seriousness of non-compliance. They believe that skipping one dose or missing one appointment won't matter, but they don't understand that these small decisions can lead to serious consequences that could cost them their health or even their life. This heartbreaking feeling worsens when doctors see patients admitted to the hospital in critical condition, and the cause is simply neglecting their treatment plan. In those situations, doctors not only feel sorrow for the patient's condition but also experience an indescribable sadness, knowing that if the patient had simply adhered to the treatment plan, this situation could have been avoided. They know that these emergency cases are not something doctors can prevent with medicine or treatment methods alone. Only the patient's adherence and determination can help them overcome illness and live a healthier life. The most heartbreaking moment is when doctors witness patients pass away, those who could have been saved if they had just followed the doctor's advice. The patient's lack of responsibility has led to unnecessary deaths, and this is a sorrow that will never fade for doctors. Patients' non-compliance with treatment plans not only causes them physical pain but also causes deep sadness for doctors and their families. Doctors often feel helpless when they see their patients not following instructions, despite their best care and advice. Every time they prescribe a medication or suggest a treatment, doctors always hope that the patient will understand the importance of compliance in order to improve their health. But that does not always happen. The greatest sadness is when doctors see patients hospitalized in serious condition just because they did not follow the treatment plan. Patients with chronic diseases such as asthma, diabetes, or cardiovascular disease can avoid emergency rooms, even dangerous complications, if they follow the instructions properly. However, because of impatience, forgetting to take medication, or not fully understanding the harm of skipping follow-up visits, they put themselves in danger. Every time doctors are faced with an avoidable emergency, they not only feel disappointed but also hurt. They know that if the patient had followed the treatment plan, things could have been different. But now they are faced with the irreversible consequences. The sadness is even deeper when doctors witness patients passing away in pain, a death that could have been completely avoided if the patient had followed the treatment plan. Doctors can do nothing more than care for them in their final moments. For the patient's family, the irresponsibility in following the treatment plan is an indescribable pain. They have to watch their loved ones struggle in pain, and finally pass away with regret, because the death could have been prevented if the patient had followed the doctor's advice. When patients do not adhere to their treatment plans, the consequences they face are not only a decline in their health but also profound sorrow for their doctors and their families. Doctors, as healthcare providers, always strive to offer the best treatment protocols, hoping to improve their patients' quality of life and help them overcome pain and danger. However, sometimes their efforts prove futile when patients fail to follow the doctor's instructions. The most heartbreaking part is when doctors witness their patients experiencing serious complications simply due to a lack of patience in following the treatment plan. Patients with chronic conditions like diabetes, heart disease, or asthma, if they had just adhered to their prescribed medications and attended regular follow-up appointments, could avoid many emergency situations and unnecessary pain. Yet, they often skip doses, neglect important appointments, and slowly worsen their conditions. This sorrow is not only carried by the doctors but also by the patients' families. They watch their loved ones grow weaker, endure unbearable pain, and even face hospitalization in critical condition, all due to poor treatment decisions. Sometimes, doctors must stand by their patients as they pass away, knowing that this death could have been avoided had the patient consistently followed the treatment plan. There is nothing more painful than seeing a patient die because of their own irresponsibility, while the doctor can do nothing but watch a life fade away. The feeling of regret and helplessness is something doctors bear each time a patient fails to follow their treatment instructions. Non-adherence to treatment plans is not only a problem for patients but also a profound sorrow for their doctors and loved ones. Throughout the healthcare process, doctors always strive to provide optimal treatment protocols, hoping that patients will follow them to improve their health and avoid serious complications. However, things don't always go as expected. A patient's lack of responsibility in following instructions can lead to serious consequences that they could never have anticipated. Each time a doctor witnesses their patient being hospitalized in a critical condition or even passing away due to not following the treatment plan correctly, it is an unbearable pain. Doctors feel powerless when they see patients who could have been saved if they had followed the doctor's orders but didn't. These unfortunate lives are lost because of impatience, because of unforeseen wrong decisions. For the patient's family, the irresponsibility in treatment also brings endless sorrow. They watch their loved ones suffer from illness and pass away with regret. The death of a person that could have been avoided simply because they didn't listen to the doctor's advice leaves an irreplaceable void in the hearts of those who love them. These stories serve as a reminder of the importance of adhering to treatment plans and the impact that small decisions in healthcare can have. Patients need to understand that each decision, every dose of medication, every medical appointment, can determine their survival. And doctors, although always doing their best, can only hope that patients will understand and follow through to protect their own health.